So the first exercise I'm going to recommend is really just an awareness exercise to give you an idea of how you're normally standing, and then try to find the correct amount of thoracic extension and opening up the heart, that feeling of the chest opening up that you're going to want to be standing with. And I find this is definitely way better to do. You can just feel it without a mirror, but if you have a full length mirror, that is really helpful, because you can see good alignment, and then if you can get the connection between how it feels and how it looks, that's also really helpful. So basically all you're going to do is stand with your mirror, and sometimes it helps to say exaggerate a slouch and then open up out of it, and you might go further and sort of open way back, overextend a bit, and then you start to feel where you're going to feel a midpoint and you feel a certain kind of poise and balance, and just keep sort of experimenting with it until you find something that you think feels good and looks good. And also you can work with adjusting your head if you think it's cropping out too much. You can also feel your body. Notice your shoulders. It's a really good thing to do for just 5 minutes to help your brain get a sense of, okay, when I feel like this, that's how it looks. And does, we have a very visual brain, so it's quite easy for us to see really quickly, well, no, that doesn't look right, or yes, that looks like I'm in balance. So that's the first one. Okay, so this I think is the most important exercise for correcting thoracic kyphosis, because, and it's not what I'm doing right now, it's what I'm about to do. It's a variation of the cobra pose from yoga, and essentially it's the exact opposite of slouching. And there's a couple of things to pay attention to. The first one is that I'm not going to be, in some of the cobras, you go into a neck extension, so I'm not going to do that. I'm going to have my chin tucked in and try to lengthen out through the back of the neck. And the other one is that the arms are going to be back and out, and try to turn the thumbs upwards and away from the body. Get as much stretch through the chest and the biceps and the shoulder there as I can. So basically, this is what it is. So trying to keep the chin tucked in, arms back and out, and go into as much thoracic extension as you can. And you just hold that. And you can do a few sets of those. I've already done about 6 today, so I'm kind of a bit tired in those muscles. But that is an awesome exercise to counteract slouching. Alright, this next exercise is actually more for forward head posture, but the thing is that slouching or thoracic kyphosis and forward head pretty much go hand in hand. They kind of create each other. And basically all you're doing is standing against the wall and trying to pull your head back into the wall without extending, you can tuck your chin a little bit, just trying to keep the head flat. So you're just going to hold that, and you can also open your arms out, kind of like the last exercise. That adds a nice, it's a bit more subtle than the last exercise, but there's definitely an arm and chest stretch, which is kind of nice to go with this. And if you do have a tendency to have a forward head like I do, then it can feel a little bit uncomfortable to start with. But the more you do it, the more the back of the neck extends, and you actually start to strengthen the deep muscles of the front of the neck. Okay.